Hello, my name is Valentina and I will present sleep disorders. What is sleep? The periodic state we enter marked the absence of wakefulness and the loss of consciousness of one's surroundings. Dreams, changes in brain activity, body temperature, and physiological functioning occur during sleep. Four of the most common sleep disorders include insomnia, sleep apnea, narcolepsy, and REM sleep behavior disorder. Sleep is considered essential to the restoration and recovery of vital bodily and mental functioning. Stages of sleep. Sleep is composed of stages which are classified as non-REM and REM sleep. Stage number 1, non-REM, dozing off stage. Body not fully relaxed, brain starts to slow, light changes in brain activity, easily awakening, last 1 to 5 minutes. Stage number 2, non-REM, drop in body temperature, muscles start to relax, slower breathing and heart rate, brain activity slows, cycle typically lasts 10 to 60 minutes. Stage number 3, non-REM, deep sleep, not easily awaking, slower heart rate and breathing than stage 2, critical to restoration and growth, 20 to 40 minutes duration. Stage number 4, REM, rapid eye movement stage. Brain activity increases to near awakened levels. Atonia occurs, which is the temporary paralysis of muscles except the eyes and necessary bodily muscle involving heart, lungs, and so on. Vivid dreams sometimes present, may last a few minutes to an hour, essential to memory, learning, and creativity. 25% of adult sleep is typically in the REM stage. Disruptions or dysfunctions during these cycles can cause sleep disorders to appear. Insomnia. Insomnia is a common sleep disorder that involves the inability to fall asleep and or stay asleep. Symptoms: lying awake for an extended period before sleep, short periods of sleep, being awake most of the night, feeling excessively tired when waking up too early. Very common, has two types: acute, short term, usually lasts a few days or weeks, often caused by the stress, work pressure, or traumatic events. Chronic, long term, lasting longer than 1 month. It is usually a symptom of something else rather than being the primary problem. Chronic insomnia causes include substance abuse or prescribed medication use, chronic stress, travel and shift work, and certain medical conditions. Higher risk groups include those who are emotionally distressed, have lower incomes, work at night, or have fracturing work schedules, and have an active lifestyle. Treatment options often involve cognitive behavioral therapy, seeks to alleviate anxiety associated with not being able to sleep. Medications. Several over-the-counter and prescribed medication can help sufferers fall and stay asleep. Lifestyle changes. Examples include forming an exercise plan, having a healthy diet, limiting caffeine, alcohol consumption, especially in the hours before bed. Sleep apnea. Sleep apnea causes breathing to stop or become very shallow during sleep. Breathing pauses can last from a few seconds to minutes. These pauses can occur 30 or more times per hour. Obstructed sleep apnea is most common, causes the airway to collapse or become blocked during sleep, causes lapses in breathing. Normal breathing starts with a noticeable snort or snoring sound, but not all of those snore during sleep have sleep apnea. Higher risk of developing sleep apnea include being male, overweight, having a naturally small airway, and genetic predisposition for sleep apnea. Often goes undiagnosed, as indicators of the disorder occur during sleep. Symptoms include feeling drowsy through the day and excessive snoring during sleep. Those with sleep apnea have a higher risk of car crashes, work-related accidents, and developing other medical problems. Treatment options include lifestyle change, losing weight, aerobic exercise, wearing mouthpieces during sleep, surgery, especially for those with enlarged tonsils, and breathing machines. Narcolepsy, defined as a severe and persistent daytime sleepiness that impacts daily life, occurs because the brain is unable to regulate wakefulness and sleep. Narcolepsy issue stems from the REM stage of sleep. Sufferers often go in a REM sleep within minutes or sleep much quicker than average sleepers. Studies typically show that low levels of hypocretin 1 often correlate with narcolepsy diagnosis. Two types of narcolepsy. Type 1, sudden loss of muscle tone, cataplexy, present in REM stage sleep, and low levels of hypocretin 1. Type 2, without cataplexy or low level of hypocretin 1, not as common. Equal prevalence in men and women. Children also afflicted. Peaks at age 15 and then again at age 35. Treatments, behavior adjustments, exercise, balanced diet, medications, planned naps, driving with caution, periodic breaks, limited driving time, avoidance of alcohol and sedatives. REM sleep behavior disorder. Disorder involving physically acting and vivid and usually unpleasant dreams with vocal and sounds and violent arm and leg movement during REM sleep. Normal REM stage sleep is marked by temporary loss in muscle tone, contrary to those with this disorder. Occurs because nerve pathways in the brain that normally inhibit muscle movement during REM sleep no longer function, causing movements. Symptoms during episodes include movements, kicking, punching, arm flaring, jumping out of the bed, and physical response to action-filled dreams, often nightmares. Vocal, laughing, talking, screaming, and emotional outbursts. Ability to recall dreams if awakened during episode. High-risk groups include males over 50 taking certain medication, including antidepressants, those with narcolepsy, and those with neurodisorders such as Parkinson's disease. Recent studies have correlated pesticide exposure, farming, smoking, or previous head injury to a higher rate of this disorder. Future of sleep research. Study conducted in Britain released new evidence that lack of sleep can higher risk of dementia. 8,000 age 50 individuals took part in a sleep study spanning 25 years. Those who averaged less than 6 hours of sleep during age 50 through 60 were 30% more likely to develop dementia than those with 7 or more hours, regardless of other pre-exciting factors, mental health disorders, substance abuse. Future research aims to study the long-term effects of sleep deprivation and the physical changes to the brain and body. Research is being conducted to correlate modern lifestyle with sleep disorders, such as smartphone usage and increase in shift workers. Modern sleep studies now have take home devices such as an Apple Watch and smartphone app that can monitor sleep and give a feedback. Telehealth now allow those that may have limited access to hospitals nearby to telecommunicate with sleep specialists and receive the help they need remotely. And the final thoughts. I chose this topic because I often struggle with the sleep issues that have impacted me physically and mentally. I find the complexes of sleep to be interesting, especially when sleep becomes abnormal. We spend roughly one-third of our life sleeping. Therefore, studying sleep and addressing sleep disorders are crucial. And this is my references. Thank you.